Hello guys, welcome to Dr. Science. So today we are going to talk about stress urinary incontinence. Now what is the definition of stress urinary incontinence? So whenever there is increase in intra-abdominal pressure leading to the release of urine. Now what is meant by this? Suppose here is the abdomen, and whenever you cough or sneeze, this will lead to increase in the abdominal pressure or the increase in intra-abdominal pressure, which will lead to the irritation of the bladder, and this bladder will start releasing the urine. This is called as your stress urinary incontinence. By stress I mean increase in intra-abdominal pressure by coughing or sneezing. Okay, once again the definition is whenever there is increase in intra-abdominal pressure leading to release of urine. Now what are the causes of stress urinary incontinence? There are mainly four causes. First we will talk about the ureterovaginal fistula. Don't worry, I will draw the diagrams, then we will discuss each and everything. Okay, the first one is ureterovaginal fistula. The second one is vesicovaginal fistula. The third one is your ureterovaginal fistula, and the fourth one is completely a different one, which is your uterovesical fistula. First we will talk about the important one, which is your vesicovaginal fistula. So keep the heading vesicovaginal fistula. Now what is vesicovaginal fistula? So here is the urethra, and this urethra have the urinary bladder. Okay, we'll draw the urethra. This is the urinary bladder, and here are the ureters. Okay, for the sake of this diagram, I'll just draw the urinary bladder. Okay, so this is the urinary bladder, and here is the vagina. Okay, this is the anterior wall of vagina, and this is the posterior wall of vagina. Okay, now if there is any abnormal connection between the urinary bladder and the vagina, okay, suppose if there is abnormal connection between the urinary bladder and the vagina, that is called as your vesico means bladder. Okay, there is a fistula which is present between the bladder and the vagina. That fistula is called as your vesicovaginal fistula. So what is happening in vesicovaginal fistula? There is abnormal connection between the bladder, which is called as your vesica, and the vagina. So what will happen in this patient? Suppose if there is urine here, there is presence of urine in the urinary bladder, this urine will dribble down into the vagina and it will come out. So in the exam they will mention that there is continuous dribbling of urine from vagina. Okay, now what is the main cause of this vesicovaginal fistula? That is obstructed labor. Whenever there is obstructed labor, this will lead to formation of vesicovaginal fistula. Now why? We will try to understand here. So this is the urethra and this is the bladder. I already told you here is the anterior vaginal wall. Now imagine if in obstructed labor, the anterior vaginal wall will expand and compress the urinary bladder. This compression will lead to necrosis of urinary bladder, which will form a fistula between the bladder and the vagina. Okay, so obstructed labor can lead to vesico-vaginal fistula. So how they will frame the question in the exam? They will tell there is continuous dribbling of urine through the vagina, and not only that, the patient had previous history of obstructed labor. Okay, so that was about vesico-vaginal fistula. Next we will talk about the ureterovaginal fistula. Okay, so once again we will draw the bladder here. So here is the urethra and this is the bladder. Now usually the bladder have a sphincter here. This sphincter is called as your external urinary sphincter. As I already told you, here is the anterior abdominal wall. Okay, and this anterior abdominal wall is in contact with the urethra. As you can see here, this is the urethra, right? This is the urethra, and this urethra is in contact with the vagina, and there is a fistula developing between the urethra and the vagina. Hence it is called as ureterovaginal fistula. So what will happen in this patient? Can the urine dribble down continuously? No, the urine cannot dribble down continuously because there is a sphincter here, and the sphincter will not allow the urine to pass that easily. So whenever she will try to pee, this urine, when the sphincter relaxes, this urine will go through the urethra, and not only that, it will go through the vagina also. So this is called as your double stream of urine. So in ureterovaginal fistula, they will mention there is double stream of urine. I hope you understand that concept clearly. The third one is a very important one. Please try to keep your concentration here. This one is your uterovesical fistula. Okay, let me keep the charging cable. Okay, so as you can see here, in uterovesical fistula, what is happening, we will try to understand. So once again, here is the bladder, and this bladder is going to have the uterus here. Usually this is the vagina, and this vagina will lead to cervix. This part is the cervix, and there will be uterus covering the bladder like this. This is the uterus. Okay, if there is LSCS or the C-section is happening in some patients due to shoulder dystocia or anything like that, and the patient was given a suggestion of C-section. Okay, whenever C-section is going to happen, they will cut open the uterus, and this, after cutting open the uterus, they will remove the baby and they will suture this uterus, right? And unfortunately, some people will suture the urinary bladder together with the, they will suture the urinary bladder together with the uterus, and eventually there will be formation of fistula here. This type of fistula, which is between the uterus and the bladder, is called as your uterovesical fistula. Uterovesical fistula. Okay, vesicle means bladder. Okay, so what will be the clinical sign and symptoms of the patient? So in the exam they will mention, whenever there are menses, this patient will be having bleeding, right? Whenever the patient is having, this patient will be having bleeding. So obviously, whenever there is bleed, this bleed will travel from the uterus into the urinary bladder. Okay, the bleeding is passing from the uterus to the urinary bladder. So there will be mensuria, means blood in the urine, blood in urine associated with menses. Okay, in uterovesical fistula, whenever this patient is going to have menses, the blood will go to the urinary bladder and she will urinate blood also with it. So this is called as your mensuria, and this is associated with LSCS. So how they will frame the question? Previously undergone LSCS patient, now having mensuria or blood in the urine on having menses. Okay, they will frame the question like that. Now the final one is your uterovesical fistula. I'm sorry, this is your ureter vesical fistula. I already told you that we have the urethra, the urinary bladder, and finally the ureters. In the ureters we have this valve, okay, and this valve will not allow the backward flow of urine. Okay, and once again, here is the anterior vaginal wall, and if there is a fistula between fistula present between the ureter and the vagina, it is called as your ureterovaginal fistula. Okay, so that was about it, and once again, not only that, I want to tell you about the 3 swab test in this patient. Now please draw this diagram a little bit big. So this is the urethra, this is the bladder, and here are the ureters. The ureters have the valve, so there will be no backward flow of the urine. Okay, they will not allow the backward flow of urine to pass. Okay, so the 3 swab test is nothing but when we keep swabs. Okay, we put the cotton swabs here, one in the lower segment, one in the middle segment. We will keep a cotton swab here in the middle segment, and one in the upper segment, which is here. Okay, so what we are going to do in the 3 swab test, we are going to put the cotton swab, one in the lower half of the segment, one in the middle, and one in the upper part, okay, of the vagina. We will keep this in the vagina. Okay, and after that we will pass one dye. What is this dye? This dye is the methylene blue dye. This methylene blue will go inside the urinary bladder. So think like this: if there is a fistula present here, which is the ureterovaginal fistula, this cotton swab will get the blue color, right? If there is a fistula between the urethra and the vagina, the first cotton swab or the lower cotton swab will get the methylene blue dye. Now if there is a fistula between the urinary bladder and the vagina, which is called as the vesicovaginal fistula, the methylene blue will go here, and this will lead to blue color in the middle. The cotton swab which was present in the middle part of the vagina, it will get the blue color if there is vesicovaginal fistula. The third cotton swab is the posterior one or the uppermost. Okay, so I already told you there are valves here which will not allow the methylene blue to go to the ureters. Okay, now imagine if there is a fistula between the ureters and the vagina, which is your ureterovaginal fistula. Can this turn into blue color? No, it cannot turn. Why is that? Because the methylene blue dye that I am passing, it cannot pass through this valve. So obviously it cannot go distal ureters. Okay, so what will happen to this? What will happen to the dye here? What will happen to the cotton swab here? It will turn in yellow color. The cotton swab which was kept in the uppermost part of the vagina, it will turn into the yellow color because there is a valve there. So if the cotton swab turns into yellow color, that is ureterovaginal fistula. Okay, that was about the 3 cotton swab tests, and I will talk about the treatment in my next video. Thank you guys.